Hello friends, welcome back to our YouTube channel Doctor's Corner. Today we are going to discuss a very important infectious disease, chickenpox. Okay, so I hope you people are aware about this particular infectious disease. This is very common worldwide. Okay, so we'll discuss this particular topic of chickenpox under this following objectives or the side headings. First, we'll discuss about the problem statement, that is how common this particular infection is throughout the world as well as in India. Then we'll discuss briefly about the history of this particular disease. Then we'll discuss the most important one, the epidemiology. Okay, epidemiological factors affecting this particular disease. Okay, epidemiological factors or the epidemiological determinants. Then we will discuss about the clinical features of this particular disease, then about the diagnosis of the particular laboratory diagnosis, then finally the treatment and prevention. Okay, so under this side heading we are going to discuss this particular topic today. Okay, so coming to the very important one is the problem statement. How common is this infectious disease chickenpox? So if you see the global problem, so it is present all over the world. So this infection of chickenpox is present all over the world, and I'll let you know that chickenpox is usually caused by a virus known as varicellazostervirus. So the name of the virus is varicellazostervirus. Before going in detail about the other things, so it is basically varicellazostervirus. Okay, so primary infection of this varicellazostervirus will causes chickenpox, and it becomes latent in few of the normal human beings after the after when the disease is over. Then it may remains in the nerves and it may causes an infection later in the life. That disease, it is called as herpeszoster. We'll discuss about that also later, but timing, remember that chickenpox is caused by varicellazostervirus. Okay, and it is present globally all over the world, and all the races are equally affected. So according to one of the data, in the year 2013, nearly or globally 140 million cases of chickenpox were reported, and around 6,400 deaths, leading to deaths of by the infection caused by this varicellazostervirus, which includes chickenpox as well as herpes zoster was reported. Okay, and this was the data collected in 2015. If we consider the data from India, so in India in the year 2018, according to a data, so in the year 2018 nearly 66,963 cases were reported, which leads to 50 deaths. Okay, in 2018. So out of this, in Kerala, the maximum nearly 34,000 cases out of the 66,000 cases were there, and the mortality was highest in West Bengal. So nearly around 31 deaths were reported out of this 50 in the from the West Bengal itself. So this was the problem statement. So now coming to the history. So this chickenpox virus or this particular disease is known to mankind since years. So since 16th century mankind know this, but to our modern medicine, so it was first described in the year 1875 by Rudolf Steiner. Okay, so what he did was, so he demonstrated that chickenpox is caused by the inoculating the vesicular fluid from the patient of acute varicella. It is a person suffering from the chickenpox or a child suffering from the chickenpox. So he inoculated the vesicular fluid of that particular person who is suffering from the chickenpox to another one, and he proved that there is existence of this something known as varicellazostervirus first in the year 1875. Similarly, in the year 1945, one more scientist by name Thomas Weller. Okay, so he has isolated this particular virus, varicellazostervirus, in this cell culture for the first time in the year 1975. So as such, why this name chickenpox, whether this occurs due to eating chicken or related to chicken, it is not like that. So that it is suggested that or postulated that the chickenpox, the names come because it is similar to chickpeas. Okay, chickpeas herpes, so that's why the name given is chickenpox. Anyway, this was just a historical background and the problem statement. Now come to the main thing about the epidemiological determinants. Epidemiology is this particular disease. Okay, so you know that epidemiology is, there is a triangle which consists of a agent, then it consists of a host, then it consists of a environmental factors. So agent factors, host factors, and the environmental factors. So this can be a major 10 marks question in the third year of MBBS, okay, related to chickenpox in the epidemiological disease of communicable disease. Also this can be a 10 marks question related to theory exams of pediatrics and general medicine. Okay, so we'll discuss about these factors in detail. So first, coming to the agent factor. So as you know, this chickenpox is caused by this particular virus. So what is the name of this virus? Let me expand it very clearly. So the name of this virus is varicellazostervirus or VZV virus. Okay, the other name of this virus is human herpes virus 3. Okay, more specifically it is alpha type. Okay, alpha, human herpes alpha virus type 3. Okay, there are human herpes virus infection 1 and 2, this is 3. So varicellazostervirus. So this particular varicellazostervirus, so it is morphologically it appears like this. We are not going to go in detail about the microbiological aspect, the size, dimension and all. So just it looks like this. And the primary infection, so this varicellavirus zoster virus can leads to two important diseases. So primary infection means for the first time if a person is exposed, generally it will infect the children, so it will lead to, primary infection will lead to a condition or disease known as chickenpox, right? So chickenpox we are going to discuss in detail. The other name of the chickenpox is varicella also, because it is caused by varicellazostervirus. Now this chickenpox is the primary infection by varicellazostervirus. Now after, generally it is a mild disease and it will get treated within a week or 10 days. Okay, now after that the virus may remain inside the body, inside the nerves. Okay, inside the nerves, in cranial nerves or the sensory root ganglia somewhere in the spinal cord, and it will remain dormant. It will not cause any infection. Okay, but whenever during the adulthood, whenever there is a decrease in the cell mediated immunity due to any other disease like HIV or due to the immunosuppressive treatments or the treatment with steroids, then this virus will reinfect again, and that reinfection, that is the secondary type, that is from this varicellazostervirus, the reinfection, that clinical condition, it is called as herpes zoster. Okay, so primarily it will cause us chickenpox, and after a latent period in few individuals this may cause as herpes zoster. We are not going to discuss in detail about this herpes zoster, but time being, remember the main virus varicellazostervirus can cause us two diseases. One is chickenpox, another was this herpes zoster. The other name of this herpes zoster is shingles. Okay, usually we see this particular disease in the adulthood, and this chickenpox is the primary infection in the childhood under 10 years of age. Okay, so it is caused by same virus, varicellazostervirus. Okay, today we are going to concentrate on this primary infection with the chickenpox. So agent factors, let me summarize here. So agent, as we know, first thing is it is caused by varicellazostervirus, which can cause two diseases. Okay, then secondly, about the agent factor source. So from where this infection is transmitted is, what is the source of this infection? So the most important source of the infection is a patient of chickenpox or varicella. Okay, so a patient of the chickenpox or varicella can transmit it from the patient to the other normal individuals. Okay, sometimes, very rarely, a patient of herpes zoster, just now we have seen that case. Okay, very rarely this can also transmit this particular disease. The source of infection can be either of these two, but most common is a patient of a chickenpox. Now one more factor related to the agent is its infectivity. So infectivity is, So we'll discuss about the clinical features. So in the clinical features, we'll discuss about the rash, what type of rash it will appear. So generally it will look like this. Okay, we'll discuss in detail later in this particular video itself. So the infectivity is generally 1 to 2 days before the appearance of the rash, then there will be appearance of the rash, then after that 4 to 5 days after the appearance of the rash. So during this period, a person will be infective. Infective means that a person suffering from this varicellazostervirus infection can transmit the disease to other normal individuals, that is non-immune individuals who are not exposed to this or have not taken any vaccine. So this is the period of infectivity. Then one more factor related to the agent is secondary attack rate. Secondary attack rate. So secondary attack rate is around 90%. So what do you mean by secondary attack rate is, that is the transmission rate, okay, in the household contact. Suppose there are few kids staying in a home, and if one person, like one kid is infected by this particular virus, so there are 90% chances that it can infect the other kids. So 90% of the other normal can get infected in a household. That is known as secondary attack rate. Okay, so these are the agent factors. Now coming to the host factors, to whom it will infect this particular agent, varicellazostervirus, to him it will infect. So host factors, so humans are the natural reservoirs of this infection. So humans generally get infected by this thing. They are the natural reservoirs. So inside the body of the human only it will infect. And all races throughout the world, whether it could be Asian, Negroes, or European race, or any race, so all races are equally affected, and all sexes, that is all genders, both male and females, are equally affected. But it usually infects the children under the age of 10 years. Children less than 10 years are usually affected by this particular infection by varicellazostervirus, it is chickenpox. Then other factors is immunity, related to the immunity of the host. So generally, if a normal immune person is resistant to this infection, if at all it occurs, it is very mild, okay. But in those individuals who are having less immunity, okay, due to some disease conditions like HIV, or that is the AIDS, or due to immunosuppressive therapy for some particular disease, or due to the administration of the corticosteroids, can cause us the decrease in the cell mediated immunity, and in them this infection is more common as compared to normal individuals. And even the adults whose immunity is less, okay, they are more probable or susceptible suffering from this disease, okay. Then usually in the children, but even adults can get infected, okay. No age is exempted as such. Then about the pregnancy, that is from the mother to the baby, developing baby, it can transmit. If at all, in the if there is infection within the first 20 weeks of the pregnancy, then it can lead to some congenital varicella syndrome, okay. Nowadays is bit rare due to the universal immunization and all. So you know, congenital varicella syndrome, which will infect around 0.5 to 2% of the cases seen in the pregnant ladies. Those who are infected, out of that infected, not all will have this particular syndrome, and that is the babies born to this mother. So only 0.4 to 2% of the babies suffering from the varicellazostervirus infected mother will develop this particular disease. So these are the host factors. Then finally the environmental factors. So environmental factors, generally this disease will occur during the winter or the spring season, okay, and the virus is very much heat labile. So outside the body, if the virus survival rate is very minimal, so it mainly the cold climates and all, that is the rainy season and spring season, will help for the survival of this thing. So these are the epidemiological things what we have discussed today. Now coming to the transmission of this particular virus, how it is transmitted. So there are following ways. So first and the foremost is by droplet infection from a infected individual, same like COVID or coronavirus. So it spreads by the droplet infection. That is, if a patient is having a chickenpox, suffering from chickenpox, the patient can transmit it to the other person by the droplet infection, okay. that is, the virus is present in the nasopharyngeal secretions or saliva and all. So if at all they will sneezes or the secretion, even by speaking and all, it will go by the droplet infection and can infect it. It can also get infected by, transmitted by the direct contact. Okay, if someone do handshake with an infected virus suffering from the chickenpox, or by hugging or in close contact, so direct contact can also lead to the transmission of this. Then the thirdly, it can also transmit through the transplacental route, that is from a pregnant lady to its developing fetus. So there are three modes of transmission. One is droplet infection, second one is by direct contact, and third one is by the transplacental route. Okay, so this is all about the transmission. Then one more thing we are supposed to know is about the incubation period. I hope you people know what we mean by incubation period. Incubation period means the period after the entry of an organism or microorganism inside the host and the development of signs and symptoms inside the host. So whenever a virus enters inside a child or a kid, then immediately the child will not suffer from the signs and symptoms, that is typical rash, fever and all. So it will take some time for developing the signs and symptoms. So it will vary from around 14 days to 21 days. Okay, so 14 to 16 days. So on an average it is around 10 to 21 days. So incubation period is around 10 to 21 days, and averages from 14 to 16 days. That is, after the entry of the virus, it will take about 14 to 16 days for the appearance of the rashes. Okay, and during this period, incubation period, the person is infected, that is 1 to 2 days before the appearance of the rash and 4 to 5 days after the appearance of rash. Okay, now coming to the clinical features of this particular disease, how a patient of a chickenpox present to a healthcare provider or a doctor. Okay, so basically we divide this condition into pre-eruptive stage and the post-eruptive stage. Pre-eruptive stage and the eruptive stage. Eruptive stage, that is, as you know that this chickenpox is usually a disease manifesting the skin, so it will typically cause the rashes all over the face and the back and the chest, right? So before the appearance of the rashes, there are certain signs and symptoms. That phase, it is known as pre-eruptive phase, and generally it will last for around 1 to 2 days. Okay, for around 1 to 2 days. So before the appearance of the rash, what signs and symptoms will appear? One thing is there is fever. A child may complain of fever, then backache. Okay, backache, then shivering. So these are the possible clinical features noted. Okay, shivering, that is feeling of cold. Then finally tiredness, or also known as malaise. So these are the some prodromal symptoms seen before the appearance of the rash. Many a times the symptoms are not there, and directly there will be the eruptive stage. Eruptive stage means that is appearance of the rashes. Okay, there will be an eruptive stage. This type of the rashes will be seen on the face. So first thing about the rash or the eruptive stage, so first we'll see about the distribution of the rash. So it is centripetal in distribution, that is more amount of the lesions or the rashes are seen in the center, and during the and at the periphery it is diminishes, and finally on the palms and the soles we hardly see it's not seen on the palms and soles generally. Okay, it can be seen in the axilla also. So it is seen on the face, chest region, on the back. Okay, and on the arms and all, and it will gradually disappear from the periphery. Now what kind of lesions you will see? So, and there is a rapid evolution of this the lesions. Okay, so basically when it will start, the lesions will start as a small macule, which may gets converted into papule. Then it will be filled with some fluid that is known as vesicle or pustules, and finally there is a healing by formation of the scab. So it will take around 4 to 7 days for all these stages to take place. So those who don't know what is macule, papule, vesicle, we'll discuss in some dermatology class. Right now concentrate on these things, the stages. So there is a rapid evolution, that is immediately within 4 to 5 days this one they will get healed. Okay, they will get healed from this stage, macule, papule, vesicle and scab. And one more characteristic feature what we see is the pleomorphism. Pleomorphism means this all these stages of macule, papule, vesicle, pustule or scab will be seen simultaneously. So there will be many such rashes. Few rashes will be in the, this is known as pleomorphism. Few rashes will be in this pustule stage, few has already crusted and all. Okay, so there is a phenomenon of pleomorphism, and generally there will be fever along with the rash. So as the rash gets healed, that is there is a formation of crest, generally fever will come down. So with the appearance of the fever, the fresh lesions starts. Okay, and when the new lesions are also healed, then the fever will come down. Okay, so these are the typical features of the rash. Typically it is described as dewdrop appearance. Okay, dewdrop appearance. So hope we have discussed about the clinical features to the point. Okay, we have not gone much detail, but to the point, as the length of the video may increase, so that's why to the point. Now coming to the complications, generally this particular disease is very mild. We'll discuss about the diagnosis and treatment also, but before that we'll discuss about the complications. So in few individuals in whom the immunity, especially the cell immunity is very less, so it may lead to certain complication, though it is rare, but we are supposed to know the thing. So the most common complication in the skin, what we see, the most common complication, that is a cutaneous complication, is secondary bacterial superinfection of the skin. Secondary bacterial superinfection of the skin. Superinfection of skin, that is the same secondary bacterial superinfection of the skin, that is the same lesions. There will be bacterial infection by Staphylococcus aureus of the Streptococcus pyogenes. So these may lead to the formation of the pus. That is the most common actually complication. Actually complications are a bit rare, but still in immunosuppressive patients this can be seen. Secondly, most common extracutaneous. Okay, it is a disease related to the skin or the cutaneous tissues. So most common extracutaneous complication, if at all we see, it can be central nervous system involvement, that is neurological involvement. So in chickenpox it may lead to encephalitis, meningitis, transverse myelitis, Ray's syndrome, especially if aspirin is given as a treatment. Okay, so this thing, even with the shingles or herpeszoster, we see this thing. We'll discuss these things later. Okay, but with chickenpox, these are the possible complication, neurologic complication. But one more very important complication we need to discuss here, that is the most serious complication, not so common but serious complication if at all it occurs. So the most serious complication is when the viruses infect the lungs, that is known as varicella pneumonia. Is a serious condition because the signs and symptoms, it will be like a cough, dyspnea and all. If at all it will infect, that is, it will cause a viral pneumonia. There will be diffuse infiltration seen, okay, in the interstitial region of the lungs. So varicella pneumonia, and finally through something known as perinatal varicella. So nowadays this is not so common because of the universal immunization and all, but from the mother to the newborn, so infected mother can cause this, they can cause this perinatal varicella, that is the congenital varicella syndrome, where we can see the microcephaly and the small hands and legs and the other features. Okay, so these are the possible complications. So what are the complications for this? Secondary bacterial infection, neurological complications, varicella pneumonia and perinatal varicella. These are the complications of this. Now, what is the laboratory diagnosis? How to confirm this particular disease? Okay, so as such, laboratory diagnosis is not required because clinical features are so prominent, it can be easily identified by the clinical features and can be diagnosed for sure that it is a chickenpox. But to confirm it, if at all you want to do the laboratory diagnosis, the following methods are available. So the most important one is the polymerase chain reaction, that is varicellazostervirus DNA can be identified by this technique, polymerase chain reaction. Okay, so PCR kits are available. So with this we can detect it. Then also by the culture, varicellazostervirus culture, and isolating and identifying the virus we can do. Then immunofluorescence, that is the identification of the antibody. Okay, immunofluorescence, identification of the varicellazoster virus antibodies. can also be done. Then finally, histopathology from the vesicular lesions, that is the vesicles rash lesions. If you take the specimen of the vesicles or the fluid and see under a microscope, then make a smear typically known as Zhang smear, where see the type A inclusion bodies and multinuclear giant cells are seen. Okay, that is in the histopathology section. And finally, by the electron microscopy. So diagnosis can be done by PCR, cell culture, immunofluorescence, Zhang smear, and by electron microscopy the virus morphology can be seen under the electron microscope. In the the specimen will be the lesions, okay, the rash lesions, the vesicles. Okay, these are the laboratory diagnosis. Then finally coming to the treatment. So I just want to once again remind you the disclaimer of our channel. So this particular videos which we are making and discussing, it is only and only for the purpose of medical education. Okay, it is meant for the especially for the students of medical students, so that is MBBS students or other healthcare students like nursing, paramedical and all. Okay, and any other non-medical person just watching this particular lectures only for the sake of knowledge, definitely they can use this for the sake of knowledge, but never take treatment, self-medication based on this knowledge. Okay, just refer to your healthcare provider or nearby doctor for taking the particular treatment. Okay, coming back to the treatment. So generally it is a self-limiting disease. So no such specific treatment is required. It is a self-limited disease. It will heal by itself. If it will only depends on the immunity of an individual. So it is a self-limiting disease. If immunity of a child is normal, then generally it won't cause much harm. Okay, so but certain measures to be taken. So what measures to avoid the complications and all? So what to be done is, first thing is isolation to be done, because the secondary attack rate is there. So whenever the rash is seen or the fever is seen or a suspected chickenpox lesions are seen in a child, then the child should be isolated for around 4 to 6 days, so that the person or child should not infect it to the other individuals. One is isolation. Then second one is the general hygiene to be maintained. How you should maintain is by just maintaining the or cutting the or clipping the nails. Okay, so that because it will many times there will be itching of the lesions or the rash, so many times the child will itch and it will cause the secondary bacterial or other infections. So this one, and keeping the body clean by mopping with the wet hot this one mops. Okay, so the body should be maintained clean, or even the regular baths will be useful. So by us isolation and personal hygiene, baths are only contraindicated in some secondary infections and all. Okay, generally there is a misconception that there should not be bath should not be taken in a person suffering from chickenpox. Okay, anyway, isolation, general hygiene, generally it will be cured. And most important one is symptomatic treatment should be given. Symptomatic treatment means just treat the symptoms. So the most common symptom what we see is the fever. So for this fever we can give the paracetamol. We should avoid the aspirin and all, or any other NSAID is normal except aspirin, which may cause Reye's syndrome. So paracetamol will generally reduce the fever and pain, or any other painkillers can be given. Along with that, calamine lotion. Okay, just it will give a soothing effect to the lesions. However, it's not compulsory, but it can help. And antihistaminics can be given. These are just support your symptomatic treatment. Antihistamines. So antihistamines like chlorpheniramine. Okay, so that will prevent the itching. So that's all it's needed. Just a personal hygiene and isolation, and just these simple methods will help in the treatment. But in individuals whose immunity is less and there is suspected complications for this, then in then we should go for antiviral treatment. So what is this antiviral treatment, or the drugs available is acyclovir. Okay, it is a class of drugs which will kill the virus. So acyclovir. So similarly we have the valacyclovir, then famciclovir. So many things are there. Then foscarnet. So usually we don't prescribe this antiviral drugs which is not needed for an healthy immune child, but in individuals in whom the self-mediated immunity is less, and especially in adults, if at all the primary infection occurs in the adults, then this antiviral treatment is useful, okay, or else there is no role of antiviral. And if at all antivirals are used, it should be started within 48 hours, then only it will be effective to prevent the complications, okay. So this is about the treatment. Then finally, how to prevent this disease. So as a saying, prevention is better than cure. So how to prevent this disease? So we have two important things. One is varicellazostervirus immunoglobulin. So if there is a suspected individuals who is having a less cell-mediated immunity, for them we can inject varicellazostervirus immunoglobulins to them within 72 hours to be more effective, okay, within 72 hours. Even in pregnant ladies it can be used. Then secondly, the vaccines are is also available. So in the age of 12 to 24 months, these vaccines are given, and depending upon the manufacturer, the dosage varies. For example, some monovalent vaccine, one dose 0.5 ml subcutaneously can be given, okay. Depending upon the manufacturer, different dose and regimes are varying. So vaccine is a very important thing to prevent this particular disease. However, this vaccine is effective, but some individuals, even after taking vaccine, they may suffer from the chickenpox, but okay, the severity is less, and they are less prone to develop the complications of this particular disease, okay. So vaccines can be given. The effect of the vaccine is around 10 years, they say, okay. So generally most of them are globally, they are infected and they have the antibodies, and once the antibodies are there with the natural infection, then the person is immune lifelong. It is said that it is immune lifelong. Very rarely they will have a reinfection, okay. So these are the things what we have discussed today. Just to summarize what we have discussed about the chickenpox. So it is mainly caused by the varicellazoster virus. Varicellazoster virus causes two diseases. One primary infection is chickenpox, and after a latent infection in adulthood, it may cause herpeszoster or shingles. Then we have discussed about the clinical features, diagnosis, prevention, and the treatment, okay. So if you like our video, please subscribe our channel and share it with your friends. We will be making such informative videos regarding the health, and especially related to the syllabus of the MBBS, right from anatomy up to the final year subjects of medicine, surgery, gynecology and pediatrics. We are going to make all the topics video, okay. All the topic lectures will be uploaded sooner or later. Thank you very much. Have a nice day.